Шановні пані та панове, вітаємо всіх.
Dear ladies and gentlemen, may I welcome you here. We are talking about the cases of diphtheria. Our speaker is Volodymyr Kurpita, Director General of the Center for Public Health of the Ministry of Health of Ukraine. You have the floor, sir. Good afternoon, dear journalists. Based on the results of the information which was spread yesterday in the mass media regarding the cases of diphtheria in Transcarpathian region, would like to provide very detailed information about the available situation in Ukraine today, and to explain or to share with you what the plans of our Center for Public Health for the next several days. So, as of morning, October 24 this year, the Uzhgorod International affiliate, they received three urgent information about the three patients which were hospitalized. Since 2012, they had none of the cases of diphtheria in that region, and that's why the situation is very much concerned us. According to information, the first patient becomes sick on October 8th. We are talking about the foreign student in medicine. He did not leave the boundaries of Ukraine over the last 6 months. He actually went to the doctor on October 11th. According to laboratory tests, they confirmed the diagnosis of diphtheria on October 23rd. There was no serum injected because they didn't have the general picture which necessitated this injection. Then a number of different physicians who actually examined 120 students who contacted with a sick person in the university. 44 of those patients underwent the special laboratory tests. There were some kind of signs of the orthopathology. Based on the result of bacteriological analysis, they had confirmed result for two more sick persons. And actually, they revealed these bacteria, and they were hospitalized in the regional hospital. And two of them, after the commission examination, they diagnosed diphtheria. Now we have three patients. According to the bacteriological analysis, they had the positive results in 12 more persons who contacted. All of them were hospitalized, and two of them were diagnosed with diphtheria magdalec. As of today, we have 15 sick persons in Transcarpathian regions. As of today, 15 of them have been hospitalized. 4 of them are sick, and others as contact persons, as the carriers of this bacteria. 4 of them were they injected 20,000 anti-diphtheria serum. We actually informed the local authorities, local governance bodies. Today, under the mayor of Kyiv actually conducted the meeting of the urban commission on the because according to the resolution of the Minister of Health regarding the qualification signs for the emergency case, the situation has been considered as let's say extraordinary situation or local scope. Today, the representatives of the Center for Public Health went to the field trip, and they provide the necessary support and assistance in the foresee of this disease. We had 2 confirmed cases in Khmelnytsk and Lugansk regions in 2018. They registered 10 cases of diphtheria for the whole Ukraine, according to the decision of today's commission in the city of Uzhgorod, which took place on 12 a.m. They introduced anti-epidemic measures for all the contact persons, including examination, let's say, laboratory tests. In case there is no data about the vaccination or clinical signs of disease, they came up with recommendations regarding the vaccination, for which they use the vaccines for the budgetary costs, and also antibiotic, let's say, prevention measures. Now we have 20 bottles. We have to actually, by the end of this week, we will have enough of the vaccines by the end of this week. And they actually stopped the educational process in the Uzhhorod University in order to stop the spread of the infection. There was a meeting of the operation headquarters to prevent the spread and dissemination of the disease, and actually they approved of the measures recommended by the above-mentioned commission. All the positive samples were sent to the Center of Public Health of the Ministry of Health of Ukraine to determine the toxigenicity. In one case, we have a confirmed the gene of toxigenicity. This information, which is available today. Speaking about the presence of the serum, we have 192 capsules or vaccines. Last year we used 46, let's say, bottles of the vaccines. So we have enough in Ukraine. Unfortunately, in the Transcarpathian region, all the available serum has been used. And we are going to replenish the reserve to compensate for the deficit. Speaking about anti-diphtheria vaccine to vaccinate the contact persons, in Ukraine we had 4,908,000. 4.9 million in Transcarpathia. We had 800 something or 110,000 doses, which is enough to actually to take care of the necessary preventive measures. That's all information we have. Should you have questions, please raise your hands and introduce yourself. Oksana Mikhailov, Factor ACTV. Speaking about anti-diphtheria serum, in which other regions they do not have enough or less than in other regions? Take in consideration that 10 sick persons you had and you used 46 doses. If we have 15 cases, would be enough in the whole of Ukraine. Once again, the serum was delivered to the regions equal to, was distributed between the regions of Ukraine. None of the regions had deficit of those doses. Just the only region is Transcarpathian, who used 8 doses. In all other regions, the serum was not used at all, hasn't been used at all. Talking about the specifics of treating diphtheria cases, as I mentioned before, for the first persons, they did not use the serum because it is used when there are certain clinical signs of toxicity of the disease. For the preventive measures, the serum is not used. It is used only exclusively for the therapeutical purposes, for treatment. Not all the sick persons need such serum. As I mentioned before, out of 15 hospitalized persons, today, the first one and 4 more, they were diagnosed as the sick persons, and the others are the carriers, which do not, or bearers, which do not need this serum. We actually monitor the situation. I believe that today or day after tomorrow, we'll have enough serum and other deliveries or supplies of the serum. We plan by the end to have by the end of the month. Additionally, or this is a kind of scheduled delivery of serums. No, this is a scheduled, which has been planned beforehand. By December this year, all Ukraine will have enough doses. Okay, speaking about other regions, do they have to introduce some or take care of some other measures in Transcarpathian regions? Maybe they have to do something in order to stop the dissemination, spreading of the disease. I would like to emphasize that this situation was not did not happen in the Transcarpathian region, but just in the city of Uzhgorod, not for the whole of Transcarpathian region. We did not introduce any, let's say, restrictive measures for other regions. Unfortunately, this situation can happen, be available in any region of Ukraine because the level of the coverage, let's say, of anti-diphtheria vaccination is not sufficient, only 60%, but we have enough vaccines, and we recommend to all the local offices of the public health, and we emphasize that we have to activate our activities. I mean, speaking about introduction, let's say, using those doses. Victoria Dmitrenko, Ukraine TV channel. As far as we know, the serum is kind of benevolent help. If you do not purchase the Russian vaccine as it was the case before, why we do not do that from Bangladesh or India or Brazil? In other words, do you have any information about procurement? 36 million hryvnia has been planned for the state budget for this year for the purchase or procurement of the anti-diphtheria serum. It has to arrive here in the end of December. This is, I mentioned before, scheduled delivery. The delivery which took place within the framework of the humanitarian aid in August this year. It was related to the fact that there were some kind of delays with the supplies of the preparations for the state budget. Where you are going to bring the serum? There are just a few manufacturers or producers of this medical preparation. We are talking about Indian producer, which has been registered in Ukraine. If there are some other producers who can prove that they have the proper productive practice, but this is not a question to be addressed to us. And I need clarification. You mentioned that by December you will have to finish this kind of scheduled delivery. I'm talking about the plan, procurement to be done, which actually those plans were generated in the beginning of this year. Igor Bondarenko plus one TV channel. Have those students, foreign students, have been vaccinated, and there is some information that in the city of Kyiv there is a case of diphtheria, which was diagnosed in one of the schoolboys who has been hospitalized. Do you confirm that? Do you have all the grounds for the vaccination of this boy? Up till now, we do not have such information about hospitalization of any schoolboys or school children. Maybe in the social media, some social networks, this information spreads fastly, more fast. Usually we have the information at the beginning of the day, 8 a.m. If we receive such information, then we have to either to reconfirm or, let's say, cancel the information. As I mentioned, that we had two cases last year in Kyiv, in Lugansk region. We have 5 cases of sick persons and 10 carriers in Uzhgorod. Answering your question regarding vaccinated students. Thank you for the question. Since those are foreign students, among the contact or persons who contacted them, and among the sick persons, there is none of the citizens of Ukraine. We cannot either confirm or let's say can cancel the information about their vaccination because we have no medical documentation on that. We cooperate with the let's say the management of the Uzhgorod University to get that information. According to the epidemiological data, we do not have the documented confirmation about vaccination. Those persons are considered to be non-vaccinated, and that's why we are going to recommend to vaccinate them. More questions? Katerin Benko, Kyiv TV channel. How many doses of serum there are in Kyiv? 8. 8. More questions? I need some clarification. We live through the period when they are vaccinating against influenza. Can they do some vaccination in addition to that, parallel to influenza? Yes, it can be done. Any other question? The information about examination of the contact persons, we are going to continue this. To do that, and we are going to update this information by till the end of this week, because based on the laboratory examination and the medical examination. So please, I would like to invite you to visit our website and follow the information provided by the Minister of Health. Thank you for your attention. That's it.